One simple test that I do with nearly all of my bike fit clients helps to explain a key reason why cyclists get either hip or knee pain on the bike. It is fairly self-evident that to deliver maximum power throughout the pedal stroke, we want the knees to be driving as close as possible to a vertical up and down action. However, when taking video from front on during a bike fit, we can see huge differences in the line of movement of the knees. Some riders have a very vertical knee action, some riders have a lot of out to in on both sides, and some riders have a lot of difference between their knees so that one is quite vertical and the other is more out to in. When we see one knee behaving very differently to the other from front on, or both knees showing a lot of out to in motion, this is worth investigating further, as there is a correlation between that out to in movement pattern and knee pain, and it can also have a relationship with hip pain as well. Now, it's important here to understand that there may be any number of reasons why a rider has an asymmetrical knee drive or has both knees showing a lot of out to in motion. It can be due to hip tightness, low saddle position, low handlebar position or riding in the drops, cleat position, other bike fit issues, a leg length discrepancy, or just poor habits. But today we're mostly concerned about the relative strength and potential weakness of the lateral hip muscle called the Gluteus Medius and its partner muscle at the bottom of the quadriceps called the Vastus Medialis Obliquus, VMO. We want to find out if weakness in this pair of muscles is contributing to the poor movement control and also leading to hip and knee pain. When these muscles are weak and not adequately controlling the inward movement pattern of the knee during the pedal stroke, here's what can happen. Number one, the kneecap is pushed towards the outside border of the femoral trochlea, which is the shallow groove that the kneecap sits and moves in. Ideally, the kneecap will move up and down in this groove with relatively even pressure on both the inside and the outside of the kneecap. However, if the kneecap pushes more strongly to one side, it can set up inflammation and irritation here and cause pain while riding. Number two, the gluteus medius muscle, which sits on the outside of the hip, is not strong enough to control the femur, which is the thigh bone. So as other stronger muscles overpower it, the gluteus medius tendon is stretched over the underlying bursa and also over the greater trochanter bone which it attaches to. So this contact pressure can irritate the bursa and again set up an inflammatory response, and the constant load on a relatively weak muscle can set up tendon pain, which we would call tendonitis or more accurately tendinopathy. So what is the test that we can do to find this out? As I said, it's a very simple test and all you will need is a portable step and a mirror to do this test in front of. So stand on the middle of the step with one foot and very slowly take your weight forwards and step down towards the ground with your other foot. Try to make this movement as slow as possible, several seconds, and try and make the landing on the ground as light as possible, rather than an abrupt fall onto the foot. It's okay if the heel of the foot that's on the step lifts slightly during this test, although that may challenge your balance. Watch carefully to see if any of the following things occur. Firstly, does your knee drift inwards as you do the test? Secondly, does your knee wobble as you do the test, showing lack of control? Number three, does your hip on the other side drop as you do the test, again showing lack of control? Number four, do you have a heavy strike onto the ground because you've lost control halfway through the motion? If any of these events are occurring, it's likely that you do have a weakness of the gluteus medius muscle of the leg on the step and its partner VMO muscle. Now compare this to the same test done on the opposite leg. Do you see in the mirror a difference in control, a difference in the movement pattern? Does one side feel different to the other? It is very common for the leg, which has hip or knee pain while riding, to also be the knee, which drifts from out to in on the pedal stroke while riding, and of course to also be the leg which has less control on this step down test. So if indeed you see a match between the leg which has a poorly controlled step down test and the one that has hip or knee pain on the bike, there is a simple exercise that you can do to strengthen the weak muscles and help fix the problem. The exercise is called a crab walk, and to do this you will need a loop of resistance band, which you will be able to find from sports stores, and of course they're also sold in physio clinics. The best size band is one that's going to be about 30 centimeters long when it's laid down on the floor, and one that's fairly firm. For safety, sit down to put the band on around the feet, and the band should be positioned around the balls of your feet. Stand up so that the band is on light tension. Your feet should be parallel, not out-toeing and not in-toeing. You should also have a slight bend in your knees. Now step to the side slowly to stretch the band, and then step the other foot back towards the first foot. Try to keep a small amount of tension in the band when the feet are coming together. So in other words, the feet will stay a little bit apart so that the band remains in place and doesn't fall off your feet. Also make sure that you lift and place your feet. Don't drag them on the ground. Aim to do 10 steps in one direction and then 10 steps back to where you came from, and do this for 3 sets. You'll likely feel that one direction of movement is easier than the other, and this is fine. And yes, by doing the exercise this way, you are strengthening both legs, and this is fine also. Doing these crab walks specifically targets the lateral gluteal muscles and will help you maintain a vertical thigh and a vertical shin while pedaling. This will reduce the compression load on the bursa at the hip and also reduce the strain on the outside of the kneecap. You'll probably need to do this exercise 3 times a week for several weeks before you start to see and feel improvements. However, in some cases, changes can be quicker than this. It's not a bad idea to check your progress on the step-down test after a few months to see if your control and movement ability have improved here as well. Although most cyclists would assume that their legs are very strong from bike riding, it is very common to see these small imbalances which can lead to pain and injury. So go through this simple test and find out for yourself.